Welcome to Insight, the podcast bringing you the latest in eye care, treatments, and what symptoms to look out for.
So I'm now joined by Desi, who's joined Maria, and we're going to discuss lenses. So I'll come to you. How are you going to help me decide what lenses I'm going to choose to put into my eyes?
So deciding which lens to choose, it can be very confusing because there's so many different types of lenses on the market. The number one thing is to look at your lifestyle. Do you drive? Do you like to read? Do you want to be free from glasses? Those are the things you have to consider. And also your expectations need to be realistic. If you have any eye health issues, if you've been told that you have macular degeneration, some lenses might not be a good fit for you.
Okay, so on that, if I'm going to go and look for a lens, actually, could I improve? So if I'm wearing glasses now, say for example, and I've got my eyes are degrading, and I need a new lens, could I actually? And I'll ask you this: could I actually change my vision? Actually, make my vision better than it was previously?
So because we are removing the natural lens of the eye when we do the cataract surgery, we can remove it and change the prescription. So for example, if you are myope and you wear glasses, usually we can change that and correct it because we are changing the lens. So yes, the answer is yes. We can just adapt that prescription in the lens that we are putting inside the eye.
Okay. So with that in mind, I mean, I've seen some of the, the names, the different types. So you've got monofocal, bifocal. Could you explain to me a little bit about the difference between the types of lenses?
Yes, of course.
How they differ?
Yes, so monofocal lenses, they offer clear vision at one distance. So because cataracts usually happen quite a while after we start to use reading glasses, most of us are already used to wearing those reading glasses. So that's a good option if that's not an issue for you, that you'll still have to wear your glasses because we choose the distance to be clear. Multifocal lenses offer clear vision in all distances. So you'd have clear distance, intermediate, and near vision. It's kind of like the varifocal glasses. Then we have toric lenses. Now, toric lenses, they correct astigmatism, which is the shape of the front of the eye. They can be integrated into the monofocal or the multifocal lenses. And last but not least, we have the enhanced depth of focus lenses. These lenses they give us great distance vision and intermediate, but for that small print, we might need a little help with glasses.
I'm sure with those, people want to know, is there a difference in price within those lenses? Do they cost more? Do you tend to favour, and again, I know you've touched on that people within a lifestyle will decide what kind of lenses they want, but is there a price difference between types of lenses you use?
Yes, but I don't know the exact price ranges.
Okay. Is there any time, so, as a patient, you've had this great surgical procedure at Corporal Dublin, and you've restored your sight, and actually in some instances could be better. But is there any instances where you may need to remove the lenses or change the lenses?
So it's extremely rare to have to remove a lens. It can be because it moves, and this usually happens if there's a weakened part in the eye and then that moves. And very, very small percentage of patients, sometimes they don't adapt to a multifocal lenses. That's why what we need to do is do a good selection of the patient. So that means not everyone can adapt to a multifocal lens. So that's why doing a good selection is what we need to do. Sometimes if they don't adapt to it, we have to remove it. But it's extremely, extremely rare. And it's not an easy surgery to remove a lens that have been implanted years and years ago. So it's usually not something that is done. It's just when you choose your lens, it's usually the lens that you have for the rest of your life.
Great. And it's one question I didn't ask, which has sort of just come to mind. If you were to when a patient comes to see you and you're going through all of this, really talking them through what their choices are with lenses, what, again, you sort of touched on it's about lifestyle. How can they understand that what that impact or outcome will be? Is there a tool that you use, or how they're going to visualize what that's going to look like? Like when you go into for an eye test, you have, they can test which glasses are going to be best for you. Is that the same with the lens? Do they look to see what improvement they'll get with these different lenses?
Patients that have used bifocal, they might be more happy with the multifocal lenses. We can do tests to know which eye is more dominant, to know how they're going to adapt, and sometimes we can put a multifocal lens in one eye and see how they adapt and next week change. But there's not like a very clear test to know exactly how it's going to be the vision. It's more assessing the patient and asking the right questions.
Okay, no, that's great. I think we've covered everything now. We've learned everything there is to know about lenses. So thank you ever so much.